Muted. The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. My name is Elton Oswood. I am a Senior Program Analyst at the Office of Minority Health Resource Center. We're very excited today to be collaborating with our other Native agencies, particularly the Northwest Portland Area Indian Health Board, in conducting this webinar today, Healthy Native Youth, a one-stop shop for educators who want to expand learning opportunities for American Indian Alaska Native youth. Our presenters today include Stephanie Craig Rushing of the Northwest Portland Area Indian Health Board, Amanda Gaston, also with the Northwest Portland Area Indian Health Board, Jennifer Torres with the University of Texas School of Public Health, as well as Jennifer Williamson with the Alaska Native Tribal Health Consortium, Jacqueline Richards, also with the Alaska Native Tribal Health Consortium, and finally with Dr. Kirsten Black, who is a Senior Professional Research Assistant at the University of Colorado in Denver, Colorado. With that said, I will turn over the webinar to Stephanie Craig Rushing.
Thanks, Elton. First, I'd like to thank everyone for attending today and wish you all a happy Native American Heritage Month, and just express our appreciation to the Office of Minority Health for hosting today's call. Please go ahead and advance to the next slide. So to introduce myself a little bit before I jump into the agenda today, again, my name is Stephanie Craig Rushing, and I am a project director at the Northwest Portland Area Indian Health Board. It's a tribal nonprofit organization that serves the 43 tribes in Oregon, Washington, and Idaho. And I work primarily on adolescent health projects, including some of the curricula we'll be sharing today, and social marketing campaigns, and the We Are Native website. But we're excited today to kind of bring together some partners from across the country who have been collaborating around different avenues to support health education in our communities. And so today's webinar will describe the Healthy Native Youth portal. Each program will share a different curricula and some of the tools and resources that are available on this new portal. We'll offer some encouragement to folks that might have programs to submit it and offer it online through the Healthy Native Youth website, and hopefully brainstorm some strategies to support use. Though I'm not sure if the chat allows us to see the chat ideas folks have. We might have to do that some other way, but we will have time for Q&A at the end, so look forward for all of that. Go ahead and advance. So the Healthy Native Youth website was produced in collaboration by the Northwest Portland Area Indian Health Board, the Alaska Native Tribal Health Consortium, the Intertribal Council of Arizona, and the University of Texas Health Science Center. We had been working for a number of years to adapt and evaluate some evidence-based sexual health curricula, and we're looking for ways to get it into communities and into use, and put together a work group that could help support the dissemination of culturally appropriate sexual health programs. And you know, we recognized that there were disparities related to teen pregnancy and STDs and HIV in our communities, and wanted to create a resource that we could use to help educators and parents and health advocates in the community access culturally appropriate programs. So we convened a work group that included representatives from the Indian Health Service and different Indian health boards and tribal epidemiology centers, schools and teachers, and the Bureau of Indian Education had a representative, and several universities and the Office of Minority Health as well. So a very collaborative group came together and brainstormed strategies to support the dissemination of programs to reach Native youth across the lifespan, and the website emerged from this year-long planning process. Next. So we spent some time thinking about different ways to reach youth and support sex ed in different capacities, and including kind of marketing directly to teens and young adults, and communicating to parents, ways to help them talk to their children or teens about sexual health, and came up with a bunch of ideas around all of those different domains. But the online sexual health website that we're going to share today really was designed targeting teachers and educators, health promotion staff, and community settings. And so this particular tool really will speak probably most strongly to those audiences. Next slide, please. So I won't be offended if you pull up the website as we're presenting and look through it. We recognized this is kind of a screenshot of the website, and we recognize that to be effective, health curricula must be age appropriate and culturally relevant and reflect the values and learning styles of the learners being taught. And that finding curricula that meet these requirements for Native youth can be really challenging. Our different organizations each had different health programs and curricula that kind of met those requirements, but it would be really difficult to find them for teacher educators, and so we wanted to bring them all together in a one-stop shop for educators and teachers and parents to access. Next slide, please. So we have a couple of goals with the website, really to provide educators and teachers with access to a variety of different curricula, to provide some tools and resources that would help educators deliver the content and feel prepared, some training around sex education and delivery, and then for us as public health folks housed in epidemiology centers, of course we like to measure the reach and impact of our efforts, so building in opportunities to count how many youth are receiving each program, in what areas of the country, and to kind of monitor uptake of the various programs. Next slide. So if you click on the curricula tab at the top of the website there, you can see the programs that have been loaded into the site thus far. We have 6 programs available through the website right now. On the kind of view gray bar there, you can click between a bunch of different view options. So right now it's in a tiled view, or you can look at them horizontally if that is easy for you. And if you click on the program name itself, you'll be able to learn about each curriculum, including the intended age group, the setting where it can be implemented, how much time will be required to implement the program, and then lesson plans, handouts, any supplemental materials that would be helpful to implement the program. There are also recorded videos and webinars for many of them to help you deliver the program. And Finally, we provide information on how the program was designed and or whether it was adapted or evaluated with Native youth to give you more information about how it was created and what sort of evaluation findings resulted. Next slide. One of the neat features of the website is you can filter your search by a number of criteria. So if you are teaching a particular age group, you could filter to identify those programs that are within your age group. If you're looking for a program that is LGBT friendly or want to deliver it in a particular setting, you can filter by these various criteria to see which meet those criteria. Next slide. And then you can also compare the curricula in a kind of a grid format like this. And if you click the boxes along the left, you can kind of drop programs out to select those that you want to compare directly. And this allows you to kind of compare programs by class size or cost or program duration if you were specifically looking for a program that you can implement in 1 week or over the course of a semester. You could filter and compare programs. And right now, of course, there are only 6 programs in the website, so it's not terribly difficult to compare them just by eye, but we're imagining this website burgeoning at some point with lots of programs in it, and this feature should help folks when more and more programs have been added to the website. Next slide, please. So as an example, each program has its own section that allows you to kind of get this preliminary information about the program, and then if you'll see across the top there are tabs, folder tabs with more information on training and the lesson plans and the supporting materials. So each program has its own folder system just like this that you can utilize. And if you go onto the lesson plans page, there's a button where you can download all of the materials as a zip file. So you don't have to download one document at a time. You certainly can, but if you want the entire package of materials, handouts, teacher's guides, quizzes, and whatnot for each program, you can download them as a single zip file to make your life a little easier. Next slide. And as I promised, this is the feedback form. We would love to track who is using the programs that are housed on the website and how many youth have been reached by each program. So if you have implemented any of the programs on the website, we would love to hear from you about your impressions using the program. It's a brief little survey. Or if you're downloading a program and plan to use it, we'd love you to register on the website so that we'll touch base with you every 6 months to see whether you've implemented the curricula and how your students responded to it. So that's kind of an overview of the portal as a whole, and I will pass it. Oh, no, I'm sorry, one more slide. Next slide. In addition to the curricula on the website, we have a page dedicated to adolescent health resources. It includes some handouts and tips for making a clinic teen-friendly, creating a teen-friendly reproductive health visit, guidelines for creating safe clinical environment for LGBT youth, and one of the things that I find most difficult, answering sensitive questions. If you are delivering a sex ed curriculum to a group of youth who have, questions about the topic, they can really hit you with some doozy questions sometimes, and so there's a little guidelines support tool to help you answer sensitive questions in the classroom. So a variety of other adolescent health resources on the website as well. And then I'm going to hand it over to Amanda and a few of the other presenters who will share the specifics of some of the programs available on the website.
Hi there. So my name, as Steph mentioned, is Amanda Gaston, and I am from the Zuni Pueblo in New Mexico. I am a consultant for the North Indian Health Board. Before that, I was a project manager at the board, starting in 2012. So my background is in education. I worked as an international baccalaureate primary years program teacher in Thailand for 3 years before coming to the board. I currently live in Ethiopia, where I'm calling in from now, with my husband and 16-month-old son. Yes, so I a bit about Native It's Your Game. Next slide, please. So you've seen this screenshot before. So when you select the Native It's Your Game program, this page will pop up. It gives you a quick description about its features. There is an intro video snippet that you can see on the bottom right there. And Native It's Your Game is a web-based sexual health and STD HIV prevention curriculum. It's for American Indian Alaska Native youth ages 12 to 14. The program can be in a classroom or as an extracurricular program, so something like an after-school. The curriculum was originally created for use in Texas by the University of Texas, whose target demographic primarily Latino and African American population. So with the adapted version, Native It's Your Game, there is now inclusion for tribal youth, making the program even stronger and more accessible to youth all around. Next slide, please. So from the Lessons tab, you can link directly to the Native It's Your Game site. Here you can register and monitor a class's students' progress throughout the program. You do have the option of setting up an account for youth or having youth do it themselves. Both facilitators and students will need to log in every time they do want to access the site. Next slide, please. So this is a snapshot of the Native It's Your Game once you have logged in. So Native It's Your Game includes 13 internet-based lessons. Each of the lessons last about 30 to 35 minutes. And if for some reason the internet or your facility's bandwidth is an issue, the program can be downloaded onto USB drives. However, this option does not give you the opportunity to track your students' progress. So the lessons include a mix of videos, interactive activities, quizzes, animation, and there are some journal activities. The lessons cover healthy relationships, puberty and reproduction, HIV, pregnancy, refusal and communication skills, and contraception. Next slide, please. So the program features videos of Native youth, elders, and health education experts who reflect tribal and youth perspectives. The elders introduce the curriculum, provide a holistic framework around sexual health that is familiar to tribal communities. They also help to provide a cultural context to sensitive topics like the anatomy and physiology lesson, which both youth and adults had a hard time with and felt a bit uncomfortable with during the usability testing. The elders frame these sensitive topics around tribal values in the context of understanding and appreciating the circle of life. And actually, the gentleman on the top there is my uncle, and that is me, bottom right. Next slide, please. So we also to be LGBTQ two-spirit inclusive. Youth can select the gender of their partner for role-play scenarios rather than being automatically assigned a partner based on their selected gender. And in regards to teen pregnancy, we also took great care to be sensitive to the fact that some students taking the program may already be parents. So for example, this animated comic is told from the viewpoint of an Alaska Native elder who frames teen pregnancy as a life choice while exploring the pros and cons of waiting, keeping in mind that some participants may be teen parents themselves. Next slide, please. So the Native It's Your Game adaptation did go through a randomized control trial to test the efficacy of the program. There were two studies where one arm received the Native It's Your Game intervention while the other received the control arm with other health programs ranging from nutrition, tobacco cessation, alcohol and drugs, and hearing loss. And just some quick numbers here. We recruited 25 sites representing 18 tribal communities to participate in a randomized control trial. Of the 18 tribes, 11 were rural and 7 were urban sites. 14 sites received the Native It's Your Game intervention and 11 received the comparison intervention. We had 574 youth participate, so this is with a returned valid parental consent and youth assent forms. We collected survey data from youth who completed the program at 3 different stages. First at baseline, next at immediate follow-up, and then again at 12 months. Next slide, please. And this is the last slide here. So the good news is that from pre to post, we had 5 psychosocial variables out of 16 examined in the study that were significantly impacted by the Native It's Your Game program. So there was increased reasons not to have sex, increased STI and condom knowledge, increased condom and condom use self-efficacy. They were more confident obtaining and using condoms. And that is about the gist of the Native It's Your Game middle school sexual health curriculum. So we would love to have folks try it out and get your feedback on the program. So thanks for your time. And I believe we're handing Dr. Black.
Hi, my name is Kirsten Black, and I was asked to step in for Brad Morris, who just became a second-time father last night. So I'm happy for him and happy to be able to talk a little bit about Circle of Life. I also wanted also note that Carol Kaufman was unable to be here today, and she's the one who has a very long history of working with Circle of Life. And I had the pleasure of working with her for the last 5.5 years through the funding that we had through Tier 2 to test the Circle of Life program in a randomized control trial or a group randomized trial. Next slide, please. So this is the first slide that you would see on the site, and it pretty much gives you all the information about the program. One thing I wanted to mention about Circle of Life, the multimedia version, is that it's the culmination of a long developmental process for Circle of Life. Circle of Life was first developed in the 1990s as an HIV prevention curriculum and went through many iterations over the years. In the current version that you see on the website is designed for younger middle school aged children, and we tested the program with children ages 10 to 12. And we, when we did that, we worked with Native Boys and Girls Clubs in the Northern Plains. We had 15 sites that we worked with, and because of the low prevalence of sexual activity in that age group, we weren't able to show that the program affected sexual activity over the course of the time that we did the intervention and follow-up, which was 9 months. But we were able to see changes in the positive direction for many of the precursors to sexual activity, which we were happy to see. So that's the kind of the evidence base that we have for this program. Next slide, please. So the site itself is set up to be self-contained, and this slide would, well, actually what you can't see is when you first come to the website, there's the first page that you see is either for teachers or for students. And then what this slide shows is if you've clicked the teacher page or the teacher prompt, then this is what you see. The student version is relatively simple or similar. What you wouldn't see as a student, and none of the slides that we have actually show you the student, is that for the students, they would sign in by designating their state, creating a password which allows them when they come back to the program to come back to where they've left off, and then they choose a character, and the program is slightly different if you choose the boy versus the girl. Also, the state that you choose will then trigger a different type of background. So there's, I believe there's, I think maybe 8 different regional artwork that shows up as the background, which was done by different Native American artists. So what you see here, though, is for the teachers. And on the side, on the left-hand side, some of the tabs that the teacher can choose. So the overview is designed for just for anybody who comes to the program to help explain what's going on, and these are PowerPoint slides that are narrated. Then specifically there are teacher resources, which in a few slides you'll see. And one thing we realized as we did our program is that, and one thing we thought about is that oftentimes it's parents or mentors, people who might have one-on-one relationships with children who are looking for some way to share this type of information with children. So we began to create this, this tab here with the idea of, hopefully it will be further developed, but really as a resource that could be shared in teaching or helping parents to know how to use the program with the youth. And then there's a tab at the bottom, Circle of Life program, which would allow any parent or mentor to then go into the program in a slightly different way than the students will. One other thing I want to mention is because of the content of the program, we have a little pop-up that comes up for students to just have them verify that they're over age 10, and if they're not over age 10, to ask them to talk to an adult and be working through this with an adult. So we wanted to be sensitive to the content and the online venue for giving it out. Next slide, please. So the program itself is consists of 7 different chapters. The last chapter, chapter 7, is relatively small, but each chapter consists of an online content, and we optimally would hope that there would be a teacher involved that would then supplement the online information with an actual classroom-based discussion. And so we developed lesson plans to help to facilitate that, and also some training to go along with it. It's not absolutely necessary, but particularly in our projects that we did, what we learned from our community advisory group was that it's very important to have community involvement and having somebody older working through this material. So culturally, we thought it was very important, and so we developed that aspect of it. Next slide, please. So this actually goes back to what I originally had talked about, showing the teacher resource tab. And as you can see, at the bottom, there's a tab where you can get the lesson plans, and also we created teacher training videos, which are basically 10-minute long session. Each video is 10 minutes long and goes over how to teach each class. And in our study, folks loved that, and they, I think it really helped the Boys and Girls Club staff who were going to present the lessons feel comfortable with it. And so I think that will, makes it pretty easy to teach this, even if for somebody who's, not otherwise trained in sexual education. Next slide, please. And this slide is simply just showing you a couple games that are in the program. And there's games, and there's like narration, and kind of interactive decision points and videos. So it's interactive. We did a satisfaction survey with kids that were in the program, and it got really high marks from them. And we also did a similar type of survey with staff that presented the program, and again had positive feedback about it. At the end of our project, we actually worked with a vendor to kind of enhance the some of the technical sides of things, as technology changes a lot even in 5 years. And so it's optimized now for, I guess it runs faster, runs better, and all that. So that's the current state. And then I believe my last slide, if you could go to that. And this is just an example of what our lesson plans look like. And again, folks that we surveyed said that, and also interviewed, said that they were pretty easy to follow. And the website that we were just looking at, the native website, also has all the different supplemental materials, handouts, and things like that printed to make it really easy. So our goal was to try to put everything together on one website and make it super easy to present, and hopefully we achieved that, and we look forward to just the further dissemination of the program. So I think that's it for me. Thank you.
Hi everybody, Ulunga Jacqueline, Inibak Viniga Kulukisak, Gat Yalmi Ngulunga. My name is Jacqueline Richards. I am from Cayena, Alaska. I'm an enrolled tribal member of the Native Village of Cayena. I work for the Alaska Native Tribal Health Consortium's HIV/STD prevention program as a community outreach specialist. Next slide, please. Thank you. Safe in the Village is a healthy relationship and safe behaviors program developed for high school age youth, specifically people aged 15 to 19, and it can be used in different settings, and I'll share a little bit more on that later. Safe in the Village can be implemented by anybody, and it requires no special training or background or area of expertise to use the program with youth. Next slide, please. Taking a step back, I just wanted to illustrate the importance of having a resource specifically for Alaska Native people and not Alaska Native American Indian youth combined, because I wanted to share what's not on the slide as well. About 45% of all federally recognized tribes are in Alaska, and most of those communities are rural villages off the road system. And this involves our target population, our youth living out in rural communities. Next slide, please. About Safe in the Village itself, it involves a movie about a half an hour long, coupled with actor interviews, and they can be shown in different parts. It's a video program meant to start conversations about sexually transmitted infections and healthy relationships. And the movie can be shown alone, again, for example, in clinic and hospital waiting rooms, or with supplemental actor interviews as a group intervention, using a facilitator guide that comes with the resource. And the facilitator guide is a booklet on helping a community member or anybody wanting to host the program to have a conversation with youth. Just give them something to reference, and yeah, it provides a structured format to discuss the program's key messages, and I'll share a little bit more on that later as well. Next slide, please. So we received funding for the program to address the need of high sexually transmitted infections among young Alaska Native American Indian youth in rural communities. Young people between the ages of 15 to 24 experience high rates of STIs, and youth also have limited access to programs that speak directly to them. So we decided to tackle these health disparities by developing a program that's culturally relevant and age appropriate for youth living in these communities. And it was also important, again, that we created a resource that met the needs of these communities and also helped support the resources that people had. For instance, we wanted to create something that's self-sustaining, that they can implement themselves, and hence the, for example, why we have this facilitator guide is so anybody working with youth especially who has those close relationships with them, like teachers, parents, or just community members active, and activists can help support youth in their communities that they already have those ties with them. So it's just kind of natural for them to take that role and have these conversations with them. Next slide, please. I also wanted to share, it's important to highlight that we adapted this resource coming from a model evidence-based program called Safe in the City. Safe in the City is a movie about, that is proven to reduce sexually transmitted infections in clinic waiting rooms. So the resource was used to, it just kind of replayed in clinic waiting rooms while people were waiting to be seen. And we wanted to use that. We thought that might be practical, so people order the resource from us the movie and then we mail it out to their communities to show them in that way. And we began also by collecting information from our target population. We partnered with 5 communities in northern and southwestern Alaska to talk with youth and to listen to them, to hear about how they live in their communities and what they see among their peers and their just life in general, their attitudes and perceptions and knowledge and behaviors around STIs and healthy relationships. So we talked with them and we got this information from in-depth interviews with individuals, and then that's kind of where we started in creating the resource. Next slide, please. There were different parts to developing the resource in itself, but we partnered closely with communities and we involved community stakeholders and a community advisory board to help shape the program and the messages in the film too. We wanted to be sure that it really resonated with Alaska Native American Indian youth, specifically Alaska Native youth. And the film also features Alaska Native actors, and we filmed the movie in Kotzebue and in Anchorage. And here are some parts to it. For example, one thing that we like to share is that community involvement was a key process in forming the resource. For example, the top pictures, we see the Kotzebue Fire Department just being able to work closely with the members up there. We had worked with, her name is Maya Ligon. She worked with the Kotzebue Fire Department to get us permission to use the fire truck to get aerial shots for the film. And that's just a way that partnering with communities really helps make the resource the quality that it is. Next slide, please. The Safe in the Village movie, about the story itself, it's about 3 Alaskan Native youth navigating things like relationships, alcohol, and sex while thinking about their futures. And it shows safe behaviors to deal with these things. And some of the key messages focus around section STIs, include having respect for other teens' decision to delay sex, and interpersonal violence. We wanted youth to know that standing up and speaking up against acts of harassment, or youth can stand up and speak out against acts of harassment. And it's also important to have trusted adults in one's life, somebody to talk with. And another key message is alcohol abuse. In other words, it's okay to say no to drinking and using drugs and still having friends to hang out with. Next slide, please. Our goal is to determine the effect of the sexual health program on self-reported knowledge, attitudes, perceptions, and behaviors related to the key messages. And we partnered with 5 new communities in the same region for the evaluation. Evaluation is currently ongoing right now. We implemented pre and post surveys while hosting the workshop. We gave out a survey before showing the movie and having a conversation, and immediately afterwards. And we also did 6-month follow-up surveys. Next slide, please. This is currently the packaged intervention. It includes the DVD itself with the actor interviews, and the movie and the facilitator guide is mailed out with the DVD itself, and we also mail out a poster for anybody who requests the resource. That's all. Thank you. Thanks for your time.
Thank you. So I'm going to wrap up with a little bit more about the Healthy Native Youth website. Next slide, please. This is Stephanie at the Northwest Portland Area Indian Health Board again. Right now, the website currently houses 6 sexual health programs. one for young youth, 10 to 12 years old, several for middle school students, and then others for high school and young adults. But we built the website with the intention of adding other health categories very quickly. So if you have programs that address other health topics, there's a section on the website where you can upload your program, and we are able to include categories other than just sexual health. So if you have a program that focuses on drug or alcohol prevention, tobacco prevention, really any kind of adolescent healthy life skills, we really encourage you to house it together with these other programs on the website. It will be available to educators across Indian country, and you'll receive feedback from this team on its programmatic uptake and reach from folks who complete the follow-up survey feedback form, and you'll be able to go in and update the training materials and lesson plans for your particular lesson as needed. Next slide. We're open to, kind of the eligibility criteria for programs. We are looking for programs that promote positive youth development and healthy decision making, programs that were purposely designed for Native youth or adapted for Native youth, that embrace cultural teaching and learning styles, and particularly those that have been evaluated, though that includes kind of a wide variety of evaluation methodologies. So if you are interested and not sure whether your program might meet that criteria, please feel free to reach out to us, and we can chit-chat about it beforehand if you'd like to double check. Next slide, please. So we were kind of hoping we'd use a few minutes to brainstorm in the chat box about any other culturally relevant health curricula folks might know about that we could reach out to include on the website. But I think the chat is just able to be seen by the organizers. So if you do have ideas, feel free to type them in the chat box. I don't think we'll all be able to see them, but I imagine they will be relayed to us, and we'd be happy to follow up with either yourself or any other programs you might know that might be interested in being added to the website.
People can also suggest them. If the audience can see where there's a panel that says questions, you can certainly submit them there, because even if we can't, the presenters will not be able to see them, but we can definitely get it to them after the presentation. So if you see your questions box, you can put in your suggestions right in there.
Awesome. Thank you so much.
No problem.
Next slide. So the website has been up for about 2 months now. We're tracking its reach and utilization. So far, over 1,000 users have accessed to the website and visited 3 or more pages on the website. So we're pretty excited about the reach we've had just in the last 2 months. But we're, obviously still very much in our infancy, and if you have a network of educators in your community that we could reach out to, we would love to, send them information about the website. And we have kind of like a little fact sheet that we could send you, and information about uploading a curriculum, kind of an overview, walking folks through that process if you're interested in that as well. Next slide. As you can see, we've hit many of the states, but we're still clearly missing some. So if you know anyone in Wyoming, feel free to send them the link, and we'll get every state by the end of the year. That's our goal. Next slide. So similarly, if you have any ideas around how to market this website to educators or health program, health advocates in your communities or schools, please feel free to reach out to our team, and we would love to send those promotional materials to you to help get the word out. Next slide. So perfect. We've given ourselves 10 minutes for questions. Here's kind of a picture of some of our team members that you heard speak today, but we have 10 minutes left for Q&A at the end, and we'll open it up to any questions that might have come in through the chat line.
Yes, thank you, Sydney.
Unmuted.
Go ahead, everyone.
The presenter is able to hear the question.
Maybe while the questions come in, you can feel free to click to the contact information for us if anyone wants to reach out after.
Okay, so there is contact information. Okay, so we have some questions. Are you able to hear me?
Yes.
So another question we have is, are there any reports on the comparative effectiveness of the different programs? And there is a question about what is the website. And the website is www.healthynativeyouth.org.
Thanks, Elton. None of the studies compared the programs head to each other because many of them target different age groups or were designed for different audiences, like the Native Voices video and the Safe in the Village video. So none of them have been compared to each other in that way, but we have, through the evaluations when there were control groups, used other health programs that weren't focused on sexual health as a comparison group.
Okay, thank you for that. And then also for the question around subject matter expert for Two-Spirit, I would be willing to help to assist with that. I was on the working group for the Healthy Native Youth media portal, and I would be able to assist with that. And we can go ahead and contact the participant with my information, or you can contact me at enaswood@minorityhealth.hhs.gov. And then I'm going to come back to a couple of more questions. Where would I find where the programs have been implemented and tested?
So for each program, there is a tab that is called Evaluation. So once you pull up the information for that program, you can look across the top. There are about 8 tabs describing more information about that particular program. So you'd want to look in the Evaluation tab for each program's evaluation methods. And there's also kind of an adaptation or cultural relevance tab, and that will talk about any steps that were taken in terms of formative research or community usability tests or work groups involved in the adaptation.
Okay, thank you. And I want to go back to the question here about, do you have anything that addresses youth suicide?
Many of the programs, talk about relying and bringing in trusted adults and into conversations. The only program on the website right now that has a lesson specific to suicide prevention is the We Are Native program. It wasn't covered in depth today, but if you go onto the website, it's one of the 6 options, and the We Are Native lesson plans include 6 to 8 lessons, each about 45 minutes. And I know lesson number 5 is around mental health and suicide prevention, and uses the We Are Native website as a teaching tool to bring students information about different health topics that they then explore through the We Are Native website.
Okay, and then we have another question regarding tobacco prevention. Is there any programs that are geared toward tobacco prevention?
No, not yet. All of the programs right now, we're really focusing on sexual health, but we have the ability to add other programs. So if you have a program around tobacco prevention, we would love for you to add it to the website. There's a tab where you can submit your curricula through the website, and or you could reach out directly to us to help upload those materials.
Okay, thank you. And there was one last comment regarding an individual wanting to explore about collaborations amongst federal agencies with this initiative, with this web portal. I know the CDC has been involved, Indian Health Service has been involved with this, so I think there would be further discussions to be able to do that. And then also some opportunities to join some Native youth initiatives with some of the federal agencies in the health field as well. So feel free to email Stephanie Craig Rushing, Brad Morris, Amanda Gatson, or Jacqueline Richards with the contact information that's displayed. You can also reach me here at the Office Minority Health Resource Center at enoswood@minorityhealth.hhs.gov. I believe that is all the questions we have here. I apologize for a little bit of the audio issues that we had during the question and answer period, but I believe we were able to get to most of the questions, or all the questions here. I want to sincerely thank all our presenters. We had presenters in Alaska, I believe from Thailand as well, and the Portland area. So I really want to thank all the presenters for coming together to provide this wonderful resource. We're very excited that it is out there for the communities to be able to use. Again, thank you everyone for being on this wonderful collaborative webinar with the Office of Minority Health and all the agencies that took part in developing this web portal for our Native youth. Thank you again. Have a wonderful holiday. Be safe and enjoy time with your family and friends, and be very thankful this holiday season. Thank you. Akahat.
Thank you all.
Thank you everyone for coming. Again, we hope you'll have a wonderful holiday season, and the one that's coming up that involves a lot of fantastic food. Thank you for joining us today, and we hope you will all have a wonderful rest of the day.